keep you warm, not just for this moment. We'll walk a million miles through the years of our lives, never alone, 'cause I'll take you home.
The Centre for Children's Cancer and Blood Disorders at Sydney Children's Hospital Randwick is an internationally recognised centre of excellence that has been treating and caring for children with cancer from New South Wales and beyond for nearly 50 years. There is nothing more precious than the health of our children. As a mother of 3 thankfully healthy kids, sometimes when things are going well, it's easy to take for granted the health of our children. But the reality is that children do get critically sick or injured. And at these stressful and sometimes frightening times, we are all very fortunate to have the services of Sydney Children's Hospital Randwick, a world-class hospital providing our children with the best of care. The road to Sydney Children's Hospital is well travelled by many families who come from all over New South Wales and beyond by air or road ambulance, helicopter, car, train or plane for specialist medical care for their precious children. Upon arrival, they are embraced by the dedicated staff.
Doctors and nurses are going to make me feel better.
Every community through New South Wales has been touched by Sydney Children's Hospital in some way.
Our daughter Kate was diagnosed with leukaemia 3 years ago when she was 5. She finished a course of chemotherapy and was at 24 months was in remission. Unfortunately, she relapsed 7 months later and is now having a bone marrow transplant. It was a shattering experience for us, but we are just so glad to be here under the fantastic care of the doctors and nurses.
Over the past almost 50 years, the survival rate for children with cancer has increased from 20 to 80%. Through many firsts and innovations, both clinically and in research settings, the Centre for Children's Cancer and Blood Disorders has achieved national and international recognition. The centre has the largest bone marrow transplant program in the region and cares for many interstate and international patients who require these complex transplants. The first cord blood transplant in Australia was performed at the centre. The Sydney Cord and Marrow facility at the hospital conducts further research into cord blood transplants.
While 80% of children are cured of their cancer, this comes at a tremendous cost, physical and psychological, to the child and family. Currently in New South Wales there are more than 5,000 young adults who are survivors of child cancer. We know very little about the long-term health problems that these young adults might face, and we're conducting currently extensive research programs trying to come up with preventive health measures and research into the sorts of health problems these young adults will face later in life.
Can't praise the hospital and the staff enough here for all their support to help us get through this hard time.
We're dedicated to continuing improvements in the cure rates and improving the quality of treatment that children with cancer receive with us.
Before we came here from Hillston in Western New South Wales, I hadn't realised how important community support and donations are to Sydney Children's Hospital.
More than 50% of children we treat come from rural and regional New South Wales. To provide them with the best quality care, we conduct outreach clinics, and we have nurses who travel to the home, the school and the local doctors and nursing service to provide the highest quality care in the local area from which they come.
My child and all our children are the direct beneficiaries of your support. We are forever grateful to the Sydney Children's Hospital.
Cancer is still the second commonest cause of death in children. Your support to us is vital so that we can cure 100% of children with cancer. Please help us.